Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're going to talk about the structure-function approach to cancer. And Dr. Prather, we're going to talk about how the structure-function approach integrates with disease care in regards to cancer. We're going to talk about the services we provide here at the Prather Practice for cancer care. And at the end, we have a testimony from Kathy, who was helped here at the Prather Practice during her cancer treatments with her fatigue. So let's start with, Dr. Prather, what is structure-function care?
Well, structure-function care is a new term, not well understood. The FDA, if anything's introduced, either a service, a product, or treatment, they divide it up into two different categories to begin with, structure function care and disease care. So as we're looking at that, understanding those two separations on that and what's involved with that is very important. Structure function care is designed to bring the body back into homeostasis, which is balance. So structurally, if we're talking about a balanced body, it's balanced muscularly, it's balanced skeletally, it's balanced in all the physical type of aspects. So that's the structure portion of structure function care. Functional care is where the physiology is balanced. So the big key word on that is homeostasis, and homeostasis means balance. And homeostasis is the definition of health. So if you are going to a structure function doctor, what the structure function doctor is trying to do is to make you healthier. And structure function does not involve anything that takes you out of homeostasis. So that's the short and quick definition of it.
Well, it makes sense.
Sure.
That you want to balance the systems, the body, because when they're in balance, that is health. And the abilities of the body the healthier you are, the easier the body is to shift to accommodate different types of changes. So the FDA puts healthcare into two categories.
Sure.
The structure function care is what we practice here at the Prather Practice. And then the other is disease care model.
Right.
We need both models.
Absolutely.
Dr. Prather, talk about the disease care model.
The disease care model, when you're talking about the definition of disease, it's a set of symptoms that have been grouped together and classified to come up with a name. So diseases are, what we think of as when you go to a doctor. You have multiple sclerosis, you have type 2 diabetes, you have a set of symptoms that have been put together and then they're described as a disease. Diseases can only legitimately be treated with pharmaceuticals or surgery. That's why they don't want structure function care offices to claim that they treat a disease, because we don't actually treat diseases. What we do is we bring the body back into homeostasis, and then the body develops a balance and a health. Body takes care of things. With disease, you take different types of pharmaceuticals to help to counteract the symptoms that are associated with those particular set of symptoms, to try to bring the body back into a more functional type of state. And the time that disease care is really necessary is when the body is no longer able to bring itself back into homeostasis. And at that point, pharmaceuticals are necessary. We don't prescribe pharmaceuticals in our structure function office. We try to separate the two. That's basically what the federal government desires, is that the two are really separated, so there's no confusion on that. And then we refer out to the specialist for different type of pharmaceuticals or surgical methods, means at that point, to help with that disease.
Good. So The question is, does structure function healthcare treat cancer?
Structure function care doesn't treat any disease.
Okay.
So we're not really going after the cancer cells. Basically, you have different types of pharmaceuticals that attack the cancer cells. What structure function does is it brings the body back into homeostasis. Oftentimes, if you've developed cancer, it's the body's no longer able to get back into homeostasis, but you want to maintain as much of a homeostasis as you possibly can. During that time, it's an important part. But it does not actually, structure function care does not treat cancer directly.
Okay. Should a cancer patient have structure function care?
That's the big question. And absolutely. When you have cancer, bringing the body back into care is an extremely important aspect. When you're talking about the different aspects of care, if you become anemic, the chances of survival will decrease by 50% in several different types of cancer. So, keeping things balanced is very important during that time.
Right.
So if you're talking about functionality, keeping the liver healthy, keeping the white blood cell count up, keeping the red blood cell count up so that you can get your normal oxygenation, keeping the kidney function going, keeping the structure aligned also plays a very big role on healthcare. One thing that is very interesting, when people have structure function care while they are going through cancer treatments, there are consistently on all the tests that are done on research, is that people have 85% fewer complaints of discomfort, fatigue, all the different pains, all the different types of things that go on with the cancer treatments.
We're going to hear from Kathy, and that's exactly what happened with her. Does structure function also help keep the immunity up during
white blood cell counts is very, very important. If the white blood cell count becomes too low, it can be a real crisis for people with cancer. So keeping that white blood cell count is also a very important type of aspect of any type of cancer care.
So is there a collaboration with structure function healthcare practitioners and oncologists?
Yes. We work very well with oncologists. As a matter of fact, we get referrals. An example of a patient that we had as a referral from oncologist was he had sent a patient to me with pancreatic cancer. This gentleman, basically they had decided that there wasn't really anything further that could be done for him, which was true. He was going to die from the pancreatic cancer. But the morphine that he was taking was not touching, and they were at the maximum amount that they could give him. It wasn't touching his pain and discomfort. So life was pretty unbearable. The oncologist had told me that they had figured that, he didn't really have much longer to live, and if we could make him more comfortable, that would be great. So we asked them, what would be acceptable to do, and they felt that acupuncture would be excellent. So we started him on a regimen of acupuncture, and 2 weeks later, the oncologist gave me a call. And so I picked it up, and he says, what are you doing with my patient? I said, well, we're doing the acupuncture. Is everything okay? And he says, he came into him, and he asked him what his pain level was, and he said, none. He had absolutely no pain level. And he said, well, what's your morphine amount that you're taking? And he says, none. So he wasn't taking any morphine and had absolutely no pain or discomfort.
Wow.
And the oncologist was very impressed. He says, I'm going to write it, script, just to continue that until end of life. We were seeing him twice a week for acupuncture. And he lived another 6 months, which was unheard of.
With more quality of life.
Well, the week before he died, he actually took his grandkids to Holiday World.
Oh.
So,
awesome.
and had a great time. Mm-hmm. And then when the night that he died, he was talking to his kids, and he said, I'm not feeling that great. Mm-hmm. And they said, well, Dad, do you need to go to the hospital? And he says, yeah, I think I do. So, they got in the car and they said, are you in discomfort? He says, no, I just don't feel right. I'm not really in any pain or anything. I just don't feel well. And so they were driving there, and he says, I'm just going to put down my seat back and just rest for a little bit. Mm-hmm. So he put his seat back, and they drove there to the hospital. He'd fallen asleep, and they got out, and they went to, the emergency people came up, tried to wake him up, and he had passed away. A wonderful type of experience. We actually went to his funeral, and they had to stand up and just say how much, that made all the difference in his end-of-life, scenario. So that type of thing, is really an awful lot of what we can do, as a structural function.
That quality of life.
Quality of life. He was feeling, it could have been, an extremely painful experience. A huge amount of discomfort. With the morphine, he wasn't really functioning. Whereas with the structure function care, we were able to provide a quality of life during that time where he was fully functional those whole 6 months. Mm-hmm. So, that's the type of thing that we can really do to help along with that case.
That's great. When we come back, we're going to talk about why is structural care so important to cancer patients. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, tell us why your weight loss program is unique.
Well, we're not just interested in your weight loss. We're interested in your overall health and well-being. So, again, we are an office that is looking at homeostasis within the body. Mm-hmm. And homeostasis on your fat percentage is an extremely important part, because that determines a lot of your pH, your hormones. It has a huge effect on how your body actually works. So we're not just looking at, yes, we want you to lose weight, but we want you to lose weight in a healthy manner.
That you'll be able to keep it off.
That you'll be able to keep it off. We don't allow people to gain their weight back. Mm-hmm. We really try to keep up with them and make sure that they have a lifestyle that maintains their weight, their desired weight. And then we also check to see what is the proper weight that you should be for the percentage of fat, because that is what is really important on this. And we also look at the whole person. What is it that's actually keeping you from being able to get where you want to be, whether it's emotional issues, whether it could be like we had a patient who was low iron. And that low iron was, they just couldn't lose weight until they got their iron levels back up.
Right. We see a lot of, thyroid, endocrine system. Yeah, endocrine
system that's out of balance. So we figure out what it is that's going to get you to a healthy state. And as you get to that healthy state, it makes it very easy then to lose the weight. And people are surprised at, that they're able to lose the weight and feel so much better. That's one of the beauties of all this.
And the other thing, too, it's very individualized.
Very individualized.
We have type 1 diabetics on the program. We've had people with type 2 get off their insulin.
Sure.
So with it being medically supervised and blood work is taken, so we know exactly what's going on.
Yes, we do. And that just makes all the difference in the world. And people have different types of, it's amazing how many different individual types of needs and quirks and all sorts of things that people have, and working with them to help them to get where they want to be is always a pleasure.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, we're talking today with Dr. Prather on the structure-function approach to cancer. And Dr. Prather, in the first segment, you went over and defined structure-function care and disease care model. And if listeners have been with us for a while, they've heard the word homeostasis and structure-function, and physician means educator. And we do this radio show because you want to educate people. The FDA is who has defined our practice's structure-function. The Prather Practice. So we're talking about, and you had that beautiful story of a cancer patient that we collaborated with an oncologist and was able to give them quality of life at the end of their life. Got to spend some quality time with his grandchildren and not be in pain, like so many of cancer patients are. So let's talk about why, in the structure-function model, why is structural care so important in cancer patients? What does the spine have to do with anything, right? Or what does the spine have to do with anything?
Of course. And that's a very good question. And, as you're talking about structural care, and that's the skeletal structure, the muscles, the, just the workings of the body, which we include acupuncture along with that. Just doing the structural care is really where you get the pain and discomfort relief. So as you are working with the body, both chiropractic care, acupuncture are the two major portions of that. Massage, some exercises along with that for the structural care. Has really been the aspect that has given people about that 85% relief in symptoms.
Yeah, that's a high percentage.
It's a very high percentage. So chiropractic care, acupuncture, some of the other physical type of modalities along with that, it's a major way of reducing pain and discomfort. Matter of fact, one of the big things that we're moving on, and with the emphasis from the government, we had talked about the Surgeon General had put out a memo to all the doctors to seek alternatives from the pharmaceutical means of pain relief. And if you're actually talking about pain relief, structure, function, and discomfort relief, structure care is really the way to go. Structural care, we can get so much better long-term chronic type of pain relief than pharmaceuticals with much better function. So on cancer patients where they wouldn't really think of coming in for some chiropractic care, acupuncture, things along those lines, how about feeling 85% better?
Sounds good to me.
That's a very, very big thing, and we find that consistently, and it's not just us. These were medical researchers, oncologists who did the studies, and we're quite surprised. Now, on the structural care, they didn't see really a change on lifespan, but the comfort level and how people were feeling during that time was really, really quite remarkable. So structural care is very important for cancer patients.
Is there any risk with structural care in cancer patients?
There is. When you're talking about cancer, you can start to talk about, fragility of the bones. You can actually get cancer into the bones. There can be changes. I've had several people who came in and who actually had some degeneration in the skeletal structure. Their oncologist was concerned, about going to a chiropractor for pain relief during that time. And one of the important things is that as you go to someone, first off, that they do proper diagnosis. Mm-hmm. We do very thorough x-rays. We have Dr. Yoakum, who actually reads our x-rays, who's one of the best in the world. He actually writes the textbooks for radiology departments, so he's probably one of the tops. He tells us exactly what's going on, what can be done, what can't be done, especially with our cancer patients. Mm. And one of the nice things is that we have a very gentle type of procedure. Had a oncologist who was very concerned about, because the type of cancer that this person had usually goes to the skeletal structure, and they wanted to be sure. So I brought them down and showed them how we were going to be adjusting, and they said, "Oh gosh, that's not what I had imagined at all. Mm-hmm. That's gentler than, I worry more about my people driving in a car than, than actually
Right.
getting an adjustment now." Mm-hmm. Because you can do a lot of different types of techniques. We have people with cancer in the spine. We have patients who have severe osteoporosis, even have had fractures. And what we can do is reflex adjusting, very light types of things, absolutely no chance of any type of injury, and amazing results. Mm-hmm. So, osteoporosis, even fractures that were going on with even cancer in the spine, we can get a tremendous amount of pain relief with those in a very gentle, very safe type of a manner. So making sure that the chiropractor or whoever you're going to is used to dealing with cancer patients, mm-hmm. and knows how to do light reflex type of adjustments where there is no possibility of any type of injury is an important consideration.
Yeah, it's very gentle and non-force, adjusting.
Yeah.
Well, what are the benefits of functional care for cancer patients?
When you're talking about functional care, of course, that can help out with energy, but with functional care, there is proven longevity types of aspects associated with that. One of the things that was a very common type of thing in the past, and is actually really a lot of people really support, is detoxification of the liver. Now, that has a very big effect on cancer and the longevity of a patient. It's because the toxicity plays a very big role. Now, as you are doing that, you need to know what types of treatments are being done, because certain types of detoxifications can also pull out the chemo and the radiation and all the good effects of those things.
Interesting. Uh-huh.
So as a functional medicine doctor, you need to understand how the treatments are corresponding with what you're doing, mm-hmm. and not to interfere with the treatments. And we're very good at that. We communicate with the oncologist on what can and can't be done along with those lines. And what we can do is we use homeopathy. We use a lot of different types of techniques. We can cover a broad range of things. So we know how chemos, radiation interact with the possible functional type of care that we do. Not only on functional care do we give homeopathics, we can give herbals, we can give vitamins and minerals, mm-hmm. knowing how those respond, but we can also work with the dietary aspect too.
Which is very important.
Mm-hmm. So as I talk to the oncologist, I make sure that they know how I'm approaching that, what I'm doing. Oftentimes I'll sit there and say, now we need to detoxify the liver. We know that they're on chemo, so there's a lot of things we can't do. But we can modify the diet and really have a nice effect on that liver. Would that be, And they're usually all for that. And the interesting part is they can see the changes on the liver enzymes.
Nice.
And they're very, very pleased along those lines. In other words, if they can see that those liver enzymes are staying good, not going off, then they know that their patient has a better chance of survival. Also, the same thing with anemia. If you become anemic, there are very excellent studies that have shown that on many different types of cancer, it cuts down on your rate of survivability by 50%, which is pretty high. So how do we go on ahead and approach something along those lines? Knowing with what they're taking, knowing the interactions, those are all very important. So it's a very complicated process. Keeping it simple, working with it. We can work also through the diet to get that up to par. There are very excellent means of maintaining red blood cell count and through very non-risky ways of doing it. So the immune system, keeping the immune system up and running, there are many, many natural ways that we can maintain that so that that's not a problem. We can see that on the lab tests, see the changes that are occurring, and all of those are very important factors.
Now, are there any risk involved with functional care for cancer patients?
That's actually definitely something that you need to be very aware. By its very definition of functional care for the average person, if there's any risk involved, then it can't be functional care. It becomes disease care.
Okay.
So by the very definition of functional care and structure care has to be non-risky to be able to define as that. But when you're talking about cancer, the biggest risk is that you would be interfering with the treatments of the oncologist. So you need to go to someone who is aware of that, can we work with the oncologist to keep them informed, and then knows really what will respond and what won't. And I do have oncologists who do trust me on that, know that I won't be interfering with their process and just go for it. But there are some oncologists who are just like, I'm not, I haven't worked with you before. I'm not familiar with any of this stuff. Can you work just through diet? And I say, absolutely. So, we can work along those lines too. And but we always keep very close tabs with the oncologist so that they know what's going on, and then we can work together on this particular case.
I love that collaboration for the benefit of the patient.
It's a very important thing. I've had several oncologists that have stated that they would really love to see structure function care a part of every single cancer patient's care.
When we come back, we're going to talk about the diagnostics involved here at the Prather practice in our approach to cancer patients. And then we will have a testimony of Kathy, one of our patients with cancer that was helped through our model with her fatigue. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
We praise the colorectal surgeon, misunderstood and much maligned, slaving away in the heart of darkness, working where the sun don't shine. When it comes to spreading joy, there are many techniques. Some spread joy to the world and others just spread cheeks. Some may think the cardiologist is their best friend, but the colorectal surgeon knows he'll get you in the end.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com. About the structure-function approach to cancer. And Dr. Prather, why are diagnostics so important in the care, of cancer with structure function medicine?
Sure. The very important thing when you're dealing, with anyone, but especially in cancers, you have to know. It's not a time to guess. It's not a time to say, oh, let's try this. It's a time to really know what needs to be done. And diagnostics are a key to knowing. Matter of fact, when you're looking at the disease care and the structure function care, we as structure function care practitioners are more dependent upon and more thorough on our diagnostics than the disease care. Because disease care, you aren't really necessarily looking for the why or the cause. Whereas with structure function care, it's essential that you know the why and the cause. Because if you don't know, you don't really treat it correctly. So we're even more dependent upon good lab tests, good diagnostics, good imaging than the disease care model.
So let's start with X-rays. Why are X-rays so important?
X-rays are very important in a cancer case because you don't want to do any harm. So knowing exactly what's going on, we have a recent patient who had throat cancer and had a tremendous amount of radiation with a lot of damage to the cervical spine. So as we're looking at that, one of the things is he had asked his oncologist and orthopedic surgeon on whether he should have cancer, whether he should have chiropractic or not. With all of his neck problems, they said, oh, no. But as we talked to them, and went through it, we explained to them what we did and how it was different. And I couldn't agree with them more. A general manipulation would have just been disastrous with what he's got going on. And his neck is extremely complicated. So we have the alignment in the frontal and horizontal plane that we needed to accomplish, which we did. But then he has a lot of degeneration, and basically his cervical spine was a jigsaw puzzle, where you have some true subluxations of anteriority and posteriority with some degeneration.
Okay, I heard a big word there.
Yeah.
Subluxation.
yeah, where things were definitely misaligned, subluxed, where there's a very visible misalignment into the cervical spine that requires very careful work. So for the C4, I'm taking it from the anterior and bringing it posterior. The C5 and 6, I'm taking it posterior and bringing it anterior. And he's getting a tremendous amount of relief from it.
Yeah.
And it's a very careful type of thing. It's a very gentle type of thing because he's had a tremendous amount of damage in through there. So it's very precise, very mathematical, excellent results.
And because of the X-rays, you knew C4, and we're talking about the cervical vertebrae, was posterior or anterior.
Right. We know how many millimeters it was off, exactly how to approach it. In other words, it's a very precise type of a system on that. And the X-rays were extremely important to know what we need to do, how we need to do it, and what method we need to use. There are 40 acknowledged different systems within chiropractic. So chiropractic, if you think you know everything about it, you probably don't, because there's a lot of techniques. So it was really amazing to the doctors themselves that there were so many different types of systems that they were unaware of. So having someone who's very skilled in that, someone who does very excellent x-rays are important, and that they're interpreted correctly by a fantastic radiologist. We are the best.
And you said you had the best, who's written the textbooks for radiology courses in
Correct.
medical school. Yes. And it's nice to get that report back, and there's things that have been picked up on those x-rays.
Very important things, yes.
That we've
That's
had to
not
send
evident.
out for.
Right.
Yeah. Well, let's talk about blood work. That's something we're known for.
Yes.
They call it the Prather profile.
Correct.
Very extensive blood work. We have a lab that brings in their own phlebotomist here,
Certainly.
health lab. Let's talk more about that, the importance of that.
I'm just such a huge proponent on blood work. We do an awful lot of blood work, more than, as the labs, all the labs have said, we do far more than any other office that they've ever seen. And the reason is because we are so dependent and so base our care off of the blood work. That's just such a critical part.
You called it the blueprint.
A blueprint to health. And it really does tell us so much about everything that needs to be done. And not only does it tell us what to do, but to make sure that it's actually working. So not only do we check to see what's wrong, how it needs to be brought back into homeostasis, but then we recheck it to make sure that it is actually doing what it needs to do. So, any type of definitely, as we've had our labs looked at and our office looked at, to see, it's very definitely an evidence-based practice. In other words, we, through third-party labs, checks, x-rays, whatever, make sure that we're actually doing our job. And we do it very well.
And then you retest if there's something that needs to be tested.
Yeah, I'm a diplomat in American Board of Chiropractic Internists, which is not too many of us are out there. It's a very difficult type of program, 3 years postgraduate, and it's all about finding out what needs to be done. And I felt that my education needed to go further. In diagnostics, you have to know to be able to be successful in the treatments. I actually want to know what's wrong with the individual.
Let's talk about another diagnostic, hair analysis. Why
Sure.
is that important in the treatment of cancer?
Hair analysis is very important. It's probably one of the best ways to determine if there's some heavy metal toxicity. Certain types of heavy metals are very well known to kick off to different types of cancer. So we look for those, make sure that those are detoxed out of the system. Also, the balance of the minerals is extremely important. If the zinc-copper ratio is off, that has a huge effect on the body's ability to heal itself. There are different types of minerals that are known to have anti-cancer properties. Cesium, rubidium are some, so we check on what the levels are of that. Add those into the system if we need to help to balance out the system. And really helps the body to fight the cancer. So the hair analysis is a critical part, always something that I look for in any type of a cancer patient.
Now, tell us about the importance of a comprehensive GI analysis.
Well, that's the gut. The National Institute of Health has done a major project on the genome of the gut and all the different types of flora, what type of effect it has, and the results have been rather startling on the research on that. Matter of fact, they came out and said it's the major aspect of our immune system. And when we're talking about cancer, the immune system is absolutely critical. If the immune system was working correctly, you probably wouldn't have developed cancer in the first place. So there's always some type of immune system compromise in cancer patients. And if you want to get the full benefit of any type of treatment for cancer, the immune system function is absolutely critical. So looking at the gut and what's going on in there can play a major role in any type of cancer treatments.
Let's talk about dietary analysis. You kind of talked about that.
Sure.
That's a big part of our cancer treatment.
The diet is one of the most important things for any type of a cancer patient, understanding that, making sure that there is as little stress on the body as possible. One of the things that we recommend for our cancer patients is a food rotation diet, so that reduces the stress on the immune system. And as we reduce the stress on the immune system, then we can really get things going much better. Also, as we look at diet, different types of problems, different types of cancers actually require different types of diets, because you can put extra stress on the liver, you can put extra stress on the kidneys, and depending on what you're actually dealing with, then that's actually absolutely critical. There's a specialized diet for breast cancer, colon cancer, prostate cancer. So as we look at that, coming up with that proper diet is something that we look at.
Okay. Well, what's the method used to determine the nutritional needs of a patient?
Well, you can do specific tests. We do blood and urine to find out what are the nutritional deficiencies. The nutritional deficiencies need to be addressed, and we don't really want to guess on those. We want to know. So those are very available, very, again, evidence-based. And so as we're giving nutritional work, we're not just saying, oh, here, let's try this. We know that you're deficient, and you can actually get too much of things. So you need to know what you're doing.
It's all about that balance.
It's all about homeostasis.
Let's talk about post-cancer treatment with structure-function care. How important is the post-cancer treatment? As
you're going through, we have a lot of people who didn't come in while they were going through cancer treatment because their oncologists weren't aware of the help and actually discouraged that. But as it takes a real toll on you. I mean, that's very hard work, going through the chemo, radiation, trying to get over cancer, and you don't want to get that back again. And if you can maintain your health and well-being, then you can actually keep that from reoccurring and get your health and wellness back. Because most people are very fatigued. We've got neuropathy. We've got all sorts of different types of problems that need to be addressed. And
we only have a few seconds, and this is a big question. How will cancer be treated in the future? Maybe it's a whole other show.
We are just really excited about some of the advancements I think we're really going to see, and I think it's going to be an integrated approach.
Well, up next, find out how the Prather practice helped Kathy with fatigue caused by cancer treatments. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
I consider the blood work to be the blueprint to your health, and we've had several different radio programs on that and talked about how important it is to have at least a yearly complete blood test to find out where you are. The blood is the life force of the body. And it gives an amazing chemical picture of where you are with your health and can actually pick up all the different types of diseases that could be going on. So having a thorough blood test is one of the most important things and is recommended by everyone to make sure that your health is up to where it should be and can actually pick up any type of disease process before it becomes a major factor. So having a good blood test, a good thorough blood test, is one of the most important things that you can possibly have. One of the things that I implemented when I started my practice was a blood test that could actually cover any type of problem that was actually developed that someone could actually experience. So we came up with a profile, we gave it to the labs, but they said, wow, that's a pretty good profile. Do you mind if we offer that to other people? And I said, no, that would be fine, because I feel that that's something that could be very useful. And they named it the Prather profile. So I've actually met with other doctors before and talked to them and said, "You're Dr. Prather. Are you the Prather of the Prather profile?" And I say, yeah, because, they get a list of different profiles. And so it's actually now a national profile. So we actually have 52 different lab tests that are actually included in this profile. It covers everything from A to Z. In other words, any disease process that you could possibly have in your body, that will be covered by this particular blood test. So it is something that should be done by everyone, from no matter how young you are to no matter how old you are, at least once a year, to see what your health is. If you have a problem, this will actually pick it up. And one of the nice things about that is it is actually covered by insurance. So very excellent way of actually finding out where you are, and if there are any hidden types of problems that are going on, this will actually show it up.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. For our Restoring Hope segment this week, we now go to Elaine Reisner with another patient success story from the Prather Practice.
We are joined by Kathy to share her story at the Prather Practice. Kathy, what health situation first brought you here to the Prather Practice?
I was diagnosed with rectal cancer in February of this year. And I had to undergo some chemo and radiation prior to surgery. And the chemo and radiation really did me in. I was pretty worn out and not feeling very good. And I was told that Dr. Prather could get my system operating properly again and restore me to good health. And in fact, he did that.
Awesome.
So I was very pleased. The first appointment I had here, I drove up thinking to myself, why did I make this appointment? Because I would just like to stay in bed. I don't feel good. I came up the Friday after I had just finished chemo and radiation on Thursday. And I sat in the parking lot and kind of took a nap because I got here way early. And when I walked in, I wasn't comfortable sitting in a chair. I just wanted to go lay down somewhere. And I had an adjustment, some auricular service, and acupuncture. And I left here wide awake and singing and driving and feeling
awesome
from on the very next day. The very first day I came in.
That's fantastic.
Now, unfortunately, that kind of wears off after a couple of days, and you have to keep, your adjustments don't hold, and you have to come back and keep your body lined up and keep your energy systems clear and functioning properly. And unfortunately, chemo and radiation stays in your body for a long time, months after they've finished doing it. And so I was scheduled for surgery 8 weeks later, and so I had 8 weeks to get in as good a condition as I could, to be as strong as I could for surgery. And Dr. Prather, through those 3 services plus some supplements, some EDS, he did do very extensive blood work, evaluated all my levels of things I never thought about, like magnesium.
Mm-hmm. Sure, yeah.
and the certain things that I just didn't think about. He looked at all of those and gave me the appropriate things that he felt I needed. Mm-hmm. Really good instruction on how to use them, and I'm very good at doing anything my doctors tell me to do.
Good for you. You're a good patient.
I try to be. I also, with IU and with the work that they did for me through chemo and radiation, they gave me certain instructions too, and I followed them. And I didn't have too much trouble with that other than fatigue, mm-hmm. but a lot of fatigue. Anyway, I really feel that the Prather practice did a wonderful job for me. So after my surgery was over, and surgery really takes it out of you. I had a 6.5-hour surgery.
Goodness.
Very long surgery, and I have had a lot of tissue removed and a good chunk of my rectum, part of my colon. I have what's called a diverting ileostomy for a certain amount of time. So with all of that, I also had to adjust to that, and you don't feel as well with an ileostomy as you do with a normal bowel situation. You don't feel as well because it takes everything out of your system in liquid form instead of solid, your waste, mm-hmm. And so with that being the case, with it taking your fluids out, your blood pressure stays really low, your appetite's not very good, you need to push fluids, drink. And I didn't really feel like doing any of those things, but
mm-hmm.
again, Dr. Prather helped me because he got me some supplements that helped with my energy. He gave me a couple of supplements that helped restore my appetite. Gave me a couple of supplements that would help elevate my blood pressure a little bit. Because my blood pressure, I have a hard time keeping it at 90/60. Sometimes it's, this weekend it was 85/41, which mm-hmm. is really quite low. Mm-hmm. And at that rate, you feel a lot of fatigue and so forth. But Dr. Prather, in my opinion, is quite a genius. He understands how the body works, and he understands, by looking at your blood work, and he's a good listener, and he'll figure out what you need if you give him the time. And
sure. Now, had you gone anywhere else for any of these issues, or was this your first stop?
Well, this was my first stop because, I've never had surgery before, never been hospitalized, never been sick, been very energetic.
So that was definitely not
very
the norm.
Physically active.
Yeah.
No, I didn't. I did know one doctor from another one. But fortunately, I have some family members who come here on a regular basis, very regular, as a matter of fact, and they told me it was the only place to go. There's many members of my family that come here.
Awesome.
So
good. Great.
Mm-hmm.
Well, and it's been cool to see your transformation, too. I remember your first day that you were here, and you just
mm-hmm.
looked like just diminished and fatigued, and you were not in a good place. And so it's been really cool to see you up to your surgery, after your surgery, and everything like that. So if there was someone out there listening who may have a similar health issue or is battling even just fatigue, I mean, that alone can be very hard to deal with. What is some advice that you would give them?
Well, I would tell them they need to get in their car and drive up here. Pretty simple advice, really, because you need to get to somebody knowledgeable. You don't need to be guessing and going to the health food stores and guessing what you might need and doing the wrong thing and making matters worse. And unless you really know what you're doing, get to somebody that knows what they're doing. Mm-hmm. I didn't know anything, and I didn't want to guess at what I might or might not need. Mm-hmm. So I was, I'm very happy here.
Good. Well, it's been wonderful to be able to aid you on your road to recovery, and it'll be great to, see you as you progress and everything like that. So thank you for sharing your story.
Well, you're welcome.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. The Prather Plan weight loss program is safe, comprehensive, medically supervised, and designed just for you. Forget the trendy diets and instead start with a roadmap that actually resets your body's metabolism for optimal fat burning and increased energy. The Prather Plan has 6, 10, or 14-week programs with a proven record of success and with guaranteed weight loss. The Prather Plan is an individualized program that is tailored to your needs to create healthy new habits in your life. You'll receive support from a certified health counselor, a nutritionist, and an exercise physiologist for maximum results. Many weight loss programs can include unhealthy loss of muscle or organ weight. We target your ideal body fat percentage so you can lose body fat in a healthy way where the pounds stay off. Contact the Prather Practice today to schedule a consultation and create a healthier you. 317-848-8048 or on the web at thevoiceofhealthradio.com. The Prather Practice, restoring hope.